Good morning, everyone. On behalf of agricultureinformation.com, I welcome Dr. Debashis Dutta, and he will talk about importance and necessary steps to reduce usage of antibiotics in food-producing animals, poultry in particular. I now request the speaker to begin. Thank you.
Namaskar, everyone. My name is Dr. Debashis Dutta. We are basically into poultry industry, and today we are going to talk about a very important topic, that is reduced use or reduction or minimizing the use of antibiotics in food producing animals. Although it's poultry in particular, but we'll talk about poultry and aquaculture. In aquaculture, it will include fish and shrimps. So let us talk one by one. First, regarding usage of antibiotic. Now, why antibiotic is used? Well, let us divide the topic into few subjects, few topics, like why antibiotic is used, number one. Then, what are the options available for the industry, like the farmers? That is point number two. And point number three will be like what is the government policy, what the policy says. This is the number three. So first of all, if we talk about why the antibiotics are used, and what is the issues or the disadvantages of antibiotic usage in food producing animals, like as I said, fish and poultry and shrimp. Now, antibiotics are primarily used for two different purposes. Number one is it can be for treatment, treatment for any outbreak, like any bacterial diseases. People use antibiotics. And number two reason why people use antibiotics are, it may be in animals, it may be for growth, promotion of growth. Promotion of growth means what happens that when the animals are there, it may be fishes, it may be shrimp or poultry. Specifically in poultry, if you see, people may use antibiotics for enhanced growth, for higher growth of the birds, or maybe for higher egg production. Now, how antibiotics help the poultry farmers to get better productivity? That is basically what happens. That there are all, because in the poultry farming, the environment is not that clean like our household environments. So there are every possibility that there will be some bacterial infections. So the bacterial load is invariably will be there in any farming conditions. So when there is any bacterial contamination or bacterial load in the poultry houses, so the bird is always fighting with those birds. The bird is always challenged with those challenged by those bacteria. So while challenging those, while fighting those bacteria, the birds may fall ill. That is number one. And number two, by fighting with all those diseases, is productivity, like its capacity to produce, it comes down. The overall strength of the birds come down. And there are various issues that may develop in the bird. So to address that, people may use preventive antibiotic. That means there is no outbreak or clinical outbreak of the disease, but people will be using some kind of antibiotic in the feed. So that is how people may use preventive antibiotics, and this is what preventive antibiotic people use. And the therapeutic, one is preventive, another is therapeutic. Therapeutic is nothing but treatment. Suppose there is any bacterial infection, so people will definitely use some antibiotics as a treatment to treat the disease of the flock, the birds or the animals. So these are the two primary areas where people use. Now next comes, like, what is the issue? What is the problem if we use antibiotic regularly in the animals and in the curative, like in therapeutic usage? Now there are two things. There are two aspects here. Number one is, if we use continuously in the as preventive doses, that means the animal is not affected, but we are using antibiotics. In that case, what will happen is that those bacteria, please understand, the bacteria that are there in the environment, we are giving them sublethal dose. Sublethal dose means it is going continuously. It is not killing the bacteria. It is not killing the bacteria, or it may be killing slowly. Like the dose is not that high. It is always given at minimum or a less dosage. So when the bacteria is constantly being hit with an antibiotic for a prolonged period of time, the bacteria will change itself genetically. What we should understand is that, like, these bacteria, they're also living being. If we specifically talk about bacteria, they're also living being. So they also have their survival mechanism. They also want to live. They have different mechanisms. They have different mechanisms in themselves to survive. So when you are continuously hitting the environment, or hitting the bacteria with some kind of antibiotic, the bacteria tries to change itself. Bacteria change itself. So that is called genetic changes will take place in the bacteria. So we call that a mutation. The mutation will take place. That means what will happen when the mutation takes place? A new type of bacteria will emerge. The new type of bacteria will emerge. That will be one problem. And this is one problem. New type of bacteria will come when, if you use continuously. Number two, what will happen that when you continuously using a particular antibiotic on a population of bacteria, that antibiotic will become ineffective. The antibiotic will not work against that bacteria anymore. So for this testing, we do this antibiotics, we call ABST, antibiotic sensitivity test. So when you do those testings, you will see like the bacteria is not responding to any bacteria. So in any antibiotic. So these are the concerns when you use antibiotic for a prolonged period, sublethal doses. So it will give two things. One thing is new bacteria may arise, new type of bacteria may arise, new organism may arise, and the existing bacterial population will become resistant to the particular antibiotic. Now, if we see the health scenario globally, we have an organization like WHO, and everybody is there. There is a concept like One Health. One Health means it is health for human, health for animal, health for the planet. So the entire world is talking about One Health. That means all the health of all the living species, all the living kind of things are kind of same. We have to take care of that. Now, this antibiotic resistance, we know that millions of people are dying every year throughout the world for this antibiotic resistance. So antibiotic resistance, how it is happening? One thing can be sublethal usage or continuous usage of antibiotics in birds ration, poultry ration, or aqua ration. That can be one. And number two thing, how resistance strains or antibiotics are getting resistant. If you see in human also, what is happening is that anything happens. For example, I have some stomach upset, they will go to any pharmacy and they will buy one antibiotic. So they will prescribe any kind of antibiotic like Norflox, Norfloxacin. We know all this. So that is a very big abusing practices in as far as the antibiotic resistance, emergence of new strain of bacterial strain is concerned. So that is a very big issue. Like in the human health segment, people go to hospital, people go to any doctor, generally without any testing. They will not test anything like which antibiotic will work, how it is. So generally, antibiotic is prescribed, or antibiotics have become over-the-counter product in India. So we do not know. So we discriminate use of antibiotic in human health is very common. In human, one more things happen, that whenever you take an antibiotic, there is a particular, it's called a period. You have to use for at least 3 days, 5 days, or 7 days. So that is very important. That is very important. But in many of the cases in unaware society, people use for 1 to 2 days, or once it is your stomach is upset is over, you come back to your normal health, you do not complete the course. So when you don't complete the course, then also those bacteria, that is also an very contributing factor contributing factor for this emerging new strains and the resistance to antibiotics. So one was this usage in animal health and production continuous use. Number two is indiscriminate use of antibiotics in human health. There's one more factor, number three. If we see, India is a major producer of many synthetic antibiotics. India, China is also one, but we're also a very big player. So all the factories that produce these antibiotics, it may be the active pharmaceutical ingredient or it may be the formulations. When they manufacture the product, the wastage of that, which will also have some antibacterial effects, or the batches which do not go through, in many of the instances, it is being seen that this that cannot be sold because of substandard quality, or you are making the product, all this cleaning vessel and everything, which will contain many antibacterial molecules, antibacterial products. Many times those are being thrown to the water bodies. So if those are being thrown to the water bodies, those waste and those things, that environment, because we do not know that is getting exposed to what kind of water bodies and what kind of organism it is getting exposed, and that is also a source from which this antibiotic resistant strains and this resistance are coming, like no, not working. So basically, for this antibiotic reason, for this antibiotic new strain emergence and this resistance, one is animal health, one is human health, and one is the pharmaceutical industry. So these three parameters through which these things are taking place. So everyone should work together. Now, this under One Health system, they are trying to bring all the stakeholders together to address this issue. So that is the problem, and we are sure that the future is better. Future will be better. It will be the prospects will be better. So this is about the problem. This is about the problem statement, why the problem is happening and how the problem is coming. Now let us look into the doables. What should be done? If we talk about animal health like poultry or aquaculture, there are a few points here. Like in poultry, the use of preventive antibiotics, like as regular feed additive, is banned in the country, banned in India. So in poultry, there is absolutely very minimum usage. I will not say it is nil, but very minimum. It must have. I'm in the industry for more than 20 years now. But I can say at least it has come down to minimum level, maybe 10-15% of the farmers in the interior areas where they are not very much controlled by the authority or which are not being checked. In those very little farms, little units, they may use regular antibiotic, but it is not there basically. One thing is costing, and the second thing is the alternatives. What are the alternatives? Alternatives have also come. So actually, Europe banned, I think in 2016, the usage of preventive antibiotics in animal health. So once Europe banned, there is extensive research that is going on in this segment. Like if it is banned, what are the alternatives which can help the animals to not getting the burden of the bacterial load? So research is going on. So in poultry, there is not much usage of this antibiotics in the as a preventive measure. That is being almost being very effectively taken care by the authorities. So that is being taken care. This is about poultry. Now, if you talk about the shrimp industry, shrimp industry is a cash cow for the country. Cash cow means if you talk about the shrimp industry, more than 90% of the shrimp that the country produces, it goes to exports. It goes to US, it goes to Europe, Japan, China, and most of the developed world, they are buying shrimp from India. Now, what happens that those developed nations, they have their very strict food safety protocol. We know about that. So those countries, before accepting any consignment of shrimp that goes from India or anywhere in the world, they do check it for antibiotic residue, whether antibiotic is present or not. If antibiotic is there in that shrimp, that consignment is not accepted. They'll simply send it back. Now it is a common sense. It is a common sense. A farmer or who is doing farming, he is, if he uses antibiotic, there's no, India is not a market for the shrimp that is produced. Hardly 10% of the shrimp is consumed in the country, and everything goes to export because the values are also high, and the farming is basically done for those customers. So when the shrimp farming is basically done for those Europe or the American market, it is quite natural that the farmers will not use, because he uses where he will sell, he cannot sell. So that is how in the shrimp industry, I'll tell, shrimp industry usage of antibiotic is close to zero. It's zero. It is almost zero. They cannot use at all. And there are different government bodies who are very strictly implementing the all these measures that the farmers or the producer, they cannot use antibiotic. So in shrimp also, that usage of antibiotic is almost nil. It is not almost, it is nil only. So now what the problem is from the poultry or shrimp point of view or fish point of view, what the problem is? There's one concern that I see as a practicing veterinarian in the industry. For after usage of every antibiotic, there is a withdrawal period. Like you use the antibiotic, depending upon the molecule. After using the antibiotic, for example, for some antibiotics, some molecules is 2 days, some 3 days, or some 1 week. So that is called withdrawal period. During that withdrawal period, your chicken or your eggs should not go to the market, because the residue of those antibiotics that may remain in the chicken or in the eggs. But in India, that withdrawal period is not very strictly followed. That is an improvement area that we have. But how big is the problem? If we say how big is the problem out of this, see, somebody will use, for example, they're selling the broiler birds at 40 days. So, for example, a particular farm is having or getting infected with some bacterial problem after 35 days, and if he uses antibiotic, those farms broiler meat may have some antibiotic traces. So if you see, according to the studies, around 10 to 15%, some studies say that around 10 to 15% of the broiler chicken that may contain some trace of antibiotic, that is being seen. So this is largely the picture, is that preventive is gone in shrimp industry, nil. And the treatment, if someone uses that withdrawal period has to be followed strictly. Now, very recently, Government of India has taken a step in which they are trying to collect the data of all the poultry farmers across the country. There are lakhs of poultry farmers, so they're trying to collect the data of the entire country. Like it may be small farmer, it may be 100 or 1,000 farmers to million birds farmer. So they're trying to collect they're trying to digitize all this data. Once this data is digitized, it will be useful, or it will definitely help to address this withdrawal period issue also. So that is where we are now. The next thing comes that what are the options available? What are the options available? Actually, earlier, 20 years back or 25 years back, the options to the farmers were very minimum, very minimum. There are not many options. But now, especially after the ban in Europe and after the Vanami culture in aquaculture, where the export has gone up exponentially, so the learnings have also gone up, research have gone up, learnings have gone up, awareness have gone up. Now, what the people do, coming to poultry, there are many things that a farmer can do. Number one, the foremost thing is biosecurity. Biosecurity means the poultry house, the poultry house that is outside the bird, we should reduce the number of bacteria present. So for that, what is to be done? We should be very careful that outside the farm or inside the farm, in the floors and everything, there are many sanitizer or disinfectant chemicals, many products which are available in the market, which are approved by CDSCO, by the government of India, drug authority. So those approved products, they can use outside the farm or inside the farm to spread. If they spray regularly or whenever needed at periodically, the outside bacterial population can be minimized. That is one thing. Next thing is how to minimize the entry of the bacteria to the bird, entry of the bacteria to the birds. So there's entry points are basically three. One is feed, one is water, and one is aerosol, which comes by the air. So through water, it is very easy. Like people use water sanitizer, different water sanitizers. So through that, the entry through water can be blocked. People use different products in feed, like that entries of the feed can be blocked. But aerial infection, like human only in poultry or aquaculture, aerial infection will always remain a challenge. What best we can do, the away from the human habitation or minimum entry of visitors and vehicles to the farm, those are being practiced. So one is the surrounding we have to clean, and one is the entry point we have to clean. Number three, the internal what can do in the birds inside the gut, what can we do? So there are two things that is being regularly practiced. One is we use probiotics. And we use organic acids. So when you give probiotic, they go inside the bird, and these probiotic bacteria, they multiply there, and by competitive expulsion and by other mechanisms, they minimize the effect, or they minimize the number of the harmful bacteria that is being present in the gut. So that is one. Probiotic is one, which is now invariably everybody is using. No one wants their animals to fall sick, because if their animal is sick, then they're going to lose money. So people are certainly not interested in that. So how do this? This inside the bird, one is probiotic, and another is organic acids. Organic acid like formic acid, acetic acid. So these salts will come like sodium formate, sodium acetate, or calcium acetate. So those salts, along with the feed, when we give at minimum level 150 200 gram per ton of feed of this acid. So what they will do? They'll go inside, and they will go to the hind gut where the pH is high, and in that part you will mostly see the colonization of different harmful bacteria like E. coli, Salmonella, etc. So that part, those acids go, they reduce the pH, and when the pH is reduced, the bacteria die. So that is what is done inside the bird. So basically, to take care, to minimize the usage of antibiotic, or to minimize the chances of getting the flock sick, one is we clean the farm premises, clean, and we disinfect them regularly. Then we stop the entry points through feed and water, that is being taken care. And inside the bird, this probiotic and acidifiers, organic acids are being used. So by doing these practices, you can say at least 70 to 80% of the incidences of disease outbreaks can be addressed. So this is being done in poultry. In shrimp, you'll be surprised to know in shrimp almost every week they use probiotic, because shrimp is such a segment which is two things. One is shrimp, the animal is small, very small, prawn, shrimp is prawn. So because they are small, they are very delicate. They are highly delicate animal. That is one thing. And second thing is they that is being exported, mostly exported. And third thing is that is investment intensive also. So if you think from a shrimp farmer point of view, because it's investment intensive, he cannot lose animal. Number two, he has to export, he cannot use antibiotics. So in this context, because of this, in shrimp culture, almost every 7 to 10 days, they use probiotic. And that is a probiotic is the segment in aquaculture. If you see aquaculture, all the medicines that is being used, all sanitizers, everything, it can be sanitizer, it can be nutritional additive, or it can be some non-nutritional additive to absorb gases and everything. So in shrimp, probiotic alone is more than 50% almost in the industry. People use that much of probiotic. Only idea is so that the harmful bacteria can be competitive under competitive expulsion. They can be kept at bay, and the health of the animals can be kept healthy. So this is what it is. Uh, because of that, the industry is flourishing. Industry is flourishing. More and more countries globally are accepting our products. Our products they are accepting, and we are doing good now. In chicken and eggs, we are world number third and number fourth. So, and there's huge export also. Sheep, you just leave it because they're completely exported almost. So more and more acceptance, and that is where it is going good. But there are still it is needed for the industry, for the animal health, in animal production industry, or the protein producing animal industry, to work closely with the other authorities under One Health, and to make it a foolproof segment where the usage of antibiotic, if at all, or the withdrawal period, if it is not followed, this can be addressed. That will highly help the segment in terms of export potential, the huge export potential. The export can go up, and that will certainly help our economy and overall job prospect in the industry. So that is how it is. Thank you so much.
Thank you very much, sir, for a wonderful talk. I will take up
Yes,
the
ma'am.
questions now.
Yes, ma'am.
The first question is, what are some common antibiotics used in poultry farming, and for what purpose are they used?
Madam, some of the commonly used antibiotics will be, if we tell the name of the molecules, one is enrofloxacin, enrofloxacin. Then one more is levofloxacin. Then one more molecule we can say is tylosin tartrate. Then thiamulin hydrogen fumarate. So these are the 5 to 6 molecules that is being mostly enrofloxacin, levofloxacin, then tylosin tartrate, thiamulin hydrogen fumarate. They are the molecules that are being used. Now you asked why they are used. Mostly they are used in case of any disease outbreak. Now disease outbreaks, there can be different diseases that may come to the farm. Like some of the common diseases are, it is called CRD, that is chronic respiratory disease. Then we call it CCRD, that is complicated chronic respiratory disease. Then there's a disease called infectious coryza that may come. There may be a problem of salmonella. There may be a problem of like common bacteria like streptococci, staphylococci. They also may infect the flock. So while the flock is ill, then generally a veterinarian goes and he will decide about the which molecule is to be used, and it is used as a therapy for 3 to 5 or 7 days as per the advice.
Okay.
Yes, ma'am.
What are the key reasons behind the continued reliance on antibiotics in poultry farming in countries like India, sir?
Madam, it is, if you say the reliance of, why the reliance on antibiotic for poultry, it is exactly like human health. Like when somebody is ill, if it is, how we fall ill, it may be a bacterial disease, it may be a viral, it may be fungal, or it may be nutritional. These four, five things only from antigenic point of view. So when if the farm is ill, if the birds are ill, if the animals are ill, and if the reason is bacterial, so it is very much as it is in the human health. In poultry health also similar. When the animals are ill, you have to treat. I'm a veterinarian. I'm a veterinarian. So if the animals are ill, you have to use a medicine. So that is how it is.
Okay. How informed are poultry farmers about the risks of antibiotic overuse, sir?
Madam, poultry farming, it is, if you see the poultry farming, it is no more a farming, it is industrialization. Like the farmers are big today. Farmers are big in the sense, I'll give an example. If we talk about the commercial layer farming, that is the egg producing farm. In country, the average egg producing farming capacity will be around 1 lakh birds. Now, how much is investment needed for 1 lakh bird? It is around 10 to 12 crores. 10 to 12 crores apart from land. So that much of money is needed. I'm telling about average. Now, when talking about broiler, if you talk about a new companies coming up today, who are there in the broiler production? You have companies like Godrej. You have companies like Suguna. Their turnover is more than 10,000 crore. You have companies like Venkis. Their turnover is around 8 to 10,000 crores. So any new player who is coming into the broiler production, I personally think they need an capacity to invest around 500 crores to get into the broiler business. So that is the kind of investment that is needed to start a poultry farm today. Now, when they start a poultry farm of like for layer at least 10 to 12 crores, and for broiler 500 crores, that much investment when they made, it is an industry. It is a complete business. So even every pie, every paisa is calculated in these industries. Every paisa is calculated. So because of that, there will be it's a well structured thing. In most of the big farms, you'll find lab. There is a laboratory setup. In that, they will check for ABST. Unlike human, I'll tell you, different. There are two difference between human and animal industry. In human, you go to a doctor, or I go to a doctor. I want the doctor to treat me immediately. I want to get relief out of my pain within 1 day or 2 days. So because of that, the doctor has very minimum option to send you sample to the lab, getting the report. He cannot say that you give me a sample. The report comes after 3 days. You come after 3 days, then I'll prescribe. That is very, very difficult. Difficult in human health segment. But if you see the organized animal farming, almost everybody will have their lab. Now in lab, ABST, there's antibody sensitivity test. How it is done. Like I also have an ABST lab. You take the sample, you incubate it, and next day morning you get the report. So from an animal farmer point of view, who have invested crores of rupees, before selecting the antibiotic, he'll be interested in which antibiotic should I use. Because if the antibiotic doesn't work, there are two problems. One thing is I'm wasting money on that antibiotic. And second thing is my animals are not recovering. So that is a bigger loss. So I'll be interested my animals to recover as fast as possible. So most of the big companies, they have their own lab. They'll get the sample overnight. They will incubate in plate and all. They will check which antibiotic is working, and that is being done. With these actually uses of antibiotics are coming down, is much down actually. So that is one point we should understand. Second point, madam, from the nutrition point of view, like even I, being a human being, every human being, we generally do not know what is how much protein I require, how much calorie I require, how much calorie I require, how much vitamins A I need, how much vitamin D3 I need, how much vitamin E I need, all the minerals, like you take macro or micro minerals, all the minerals, how much I need, or different different amino acids, how much different amino acids I need. So what happens in animal industry, you'll be happy to know that, because this is a commercial, this is business, this is totally industrialized today. For example, I'll give you an example of amino acid, for example, tryptophan or valine or isoleucine or leucine. So all this amino acids, for example, if I give more to my bird, it is waste. I cannot give more. Why should I give more? If I give more, it will be wasted. And if I give less, my bird will not lay eggs, or it will lay less, or it will not, it growth will be less. So in animal health industry, animal farming, up to at least 6 to 8 or 10 amino acids are balanced. So we balance each and every amino acid, we balance each and every vitamin, we balance each and every mineral. So all those are balanced. Only a very balanced diet is given, so that the nothing is waste, no ingredient goes waste, and the bird or the animal gets optimum nutrition as much as needed to give the maximum output the bird can give as per its genetic potential. You'll be surprised to know that in the shrimp industry, the cost of the feed is around 80 rupees a kg, 70 to 80 rupees a kg of the per kg of feed. So those are expensive. Those are expensive because of that. In poultry, it is around 50 rupees a kg. So because of that, is each and every ingredient between. There are so many softwares in the market. Like Brill is one. The cost of the Brill is around 5 to 6 lakhs. So I use Brill. So you take the software, you give all the ingredients. The software will tell that no, this is more, this is less, and everything. It will give you an optimum or good formula where nothing goes waste. So that is how that people say that how the birds become fat, how the fish is getting ready in 3 to 4 months. Those are basically because one is nutrition and another is disease control. With these two approaches globally, not only in India, globally, the productivity have gone up actually. That is how it is, madam.
Okay. Are there any existing regulations or guidelines in India regarding antibiotic use in livestock and poultry? How effective are they?
Yes, ma'am. There are this as per the guidelines are concerned, the preventive antibiotic usage is banned in the country. One is banned in the country for the government in a country. For if we talk about India, for a government going to every farm and checking, that is not possible. So what the government has done is, they have number of companies are very few who are operating in the market. The medicine companies, I'm telling. So they have taken in confidence with all the medicine companies, the drug department, central drug department, state drug department. There's a strict vigilance, and because of those vigilance and these processes, any big company, somebody managing a medicine company, for example, I am managing a medicine company. So you do not do those kind of practices because of these vigilances. So rule is there, and government has effectively controlled the usage with the help of this pharmaceutical industry. Actually, they're talking to them, they're giving them guidelines, and they're following up. That is how it is done in poultry. Coming to aquaculture shrimp, it is question doesn't arise of using antibiotic, because if we use antibiotic, you cannot sell your product, as simple as that, because it has to go to US or Europe, and they will test and they will send you animals back. So there are guidelines, and guidelines are very effectively followed by the government. Very ethically, these are being done. And one only concern, as I said you, madam, like this for this withdrawal period, I think withdrawal period is the sector where we have to work little more. And after this data collection, I think that will be even much better. Now, earlier under the central government, this animal husbandry, there's no separate department. It was under agriculture. So I think 17 or 18, 2017 or 18, there's a different department now. That's called DAHD, Department of Animal Husbandry and Dairy. So DAHD, there's a different separate department now, and after the separate departments have come, things have really changed in terms of support, in terms of so we need support from the government. In the sense, if I want to export my chicken, I need support from the government. I need guidelines, because ultimately when you do business, it is with the system only. So systems are to be there, system are to be followed. After this DAHD new department has come, things have drastically improved, and things are much better now. That is how it is, madam.
Okay. What role do vaccination and probiotic supplementation play in minimizing antibiotic dependence?
Madam, this vaccination, if we talk about in poultry, there are various vaccines. There are vaccines against viruses, there are vaccines against bacteria. If we talk about antiviral vaccines, there are different diseases, like we call them, they are named as ND, Newcastle disease, infectious bronchitis, infectious bursal disease, Marek's disease, and all. So if we talk about these viral diseases, every farmer will definitely do vaccination, because if they do not do vaccination, the disease comes and the birds die. Viral diseases are the diseases which are very difficult to treat. There's no treatment. If the disease comes, the birds will die. So viral disease invariably customer will do vaccine. They have to do. 100% of the farms nationally are vaccinated. Nationally vaccinated. Bacterial vaccine, what happens that there are 2-3 diseases for which bacterial vaccines are available. One is salmonella, one is salmonella, one is infectious coryza, and one is fowl cholera. Sorry. So these three diseases for which bacterial diseases for which vaccines are available, and people do, like coryza vaccine. People do, almost every layer farm do. It needs in layers, because layers are kept for longer period. Breeders also they do. And wherever needed, wherever incidences are there, or possibility of getting the disease high incidence areas, in those areas people do vaccination with the fall cholera also. Not necessarily, it's not needed basically. And salmonella, wherever needed, people do. So bacterial vaccines are needed. They are being done to reduce or minimize the usage of antibiotic. Coming to probiotic, they have a big role. Probiotic have a big role, because probiotic along with acidifiers, that is essential oils are there. There are many things, like one is probiotic, one is essential oil, one is your organic acids. So there are different things. There are phytobiotics. There are different things that is being used to minimize the usage of antibiotic. One thing we should understand is that before the emergence of the modern treatment system, there is allopathy. Before the emergence of allopathy, also our Vedas, our ancestors, they were treating the animals with the herbs, with different phytogenic, different herbal medicine. There is Ayurveda. Ayurveda is always there. So this industry has gone back to Ayurveda in many essence globally, not only Indian market, even the European market. So because after this ban and everything, people have gone back to Ayurveda, different phytobiotics, different phytogenics. Like, you'll be surprised to know, almost many of the farmers, they use 20 kg of turmeric powder in their feed. 20 kg turmeric powder per ton. People go up to 40 to 60 kg also. Garlic powder we use. So like the different phytogenics we use. Probiotics, like Bacillus subtilis is a very common probiotic organism that we use. So probiotics are used a lot. So like this, it is a combination of probiotic, only because only with one thing, very difficult to control the bacterial outbreaks. So it is a combination of phytogenics like herbal, then probiotics, then this I said, so organic acids. So in combination, it is being very highly effective, and it is almost antibiotic free now. Most of the chicken, as I said, as per the studies, is more than 85% they don't have an antibiotic trace or residue in their chicken.
Okay, thank you very much, sir. We have now completed the round of questions on behalf of agricultureinformation.com. We
Thank you,
like
ma'am.
to thank Dr. Debashis Dutta for the talk and for answering the questions. This meeting will now be closed.
Thank you, ma'am. Thank you so much.
You're
Namaskar.
welcome, sir. Bye-bye.